In 3 long years, we've faced public health restrictions, overwhelmed hospitals, and a race to get vaccines and tests.
Before we had therapeutics, before we had vaccinations, we really saw a lot of patients, and many patients died, and it was tragic.
Dr. Isaac Bogosh witnessed that loss firsthand in Toronto. Now he's among those waiting to see if the World Health Organization will end the global emergency.
Even though it might not meet the criteria, that doesn't mean that the threat or the risk is over.
Things are going to get better.
But Dr. Alison McGeer says this virus isn't yet predictable, and it keeps finding new people to infect.
Still a sizable fraction of older adults have not yet had COVID.
The WHO's own figures show 170,000 people died globally in just the last 8 weeks, and officials say it's likely an undercount.
So this stuff's actually really cool.
That ongoing toll is because it's tough to curb infections, even with vaccines, all because this virus has evolved to sneak past even the sharpest immune systems.
We still need to generate better vaccines that are longer lasting and broader, and what the right strategy to do that will be is still a question.
It's also unclear how the world will support the millions suffering lasting symptoms of long COVID.
Those two burdens of disease, the acute and long COVID, are going to lead to an accumulation of people who are going to be sick. And that's going to be superimposed on a healthcare system that's already stretched.
Researching how to treat long COVID or developing new vaccines, it all takes time. And some scientists worry if the global emergency is ended, support and funding might end too. That could leave the world worse off in our fight against COVID and whatever threat comes next. Lauren Pelly, CBC News, Toronto.